My name is Carmen. We're going to be performing a neurological exam. This is a 31-year-old male. Chief complaint is headache. Can you tell me when your headache started?
A month ago.
And where is your headache?
Temple, right side.
This has nothing on it. I'm just taking notes. And how long does the headache last?
10-15 minutes.
Does it occur more than once a day?
Yep, 3 to 5.
And how would you describe the headache pain?
Sharp. Painful.
Does anything make it better?
Nope. Ibuprofen does not work.
Does anything make it worse?
No.
Does changing positions, coughing, or sneezing make it worse?
No.
Any radiation?
No.
Okay, and does it occur at the same time every day?
Yep.
And does it wake you up at night?
Yep.
Okay. And on a scale of 1 to 10, 10 being the worst.
10.
Okay. And is it affecting your daily activities? So you're not able to work. Okay. Can you tell me about your past medical history?
Stigmatism, wrist surgery, and LASIK surgery.
Okay. And so we have your surgery history, past medical history. Can you tell me about medications you take?
None.
Just the occasional ibuprofen for the headache as needed.
Yep.
About 200 to 400 milligrams, possibly.
Yep.
And allergies. Are you allergic to anything?
Moxicillin and seasonal allergies.
Okay. And family history.
High blood pressure.
Who has high blood pressure?
Dad.
Okay.
Mom has nothing. Grandpa died of a heart attack.
And your grandma's.
That's fine.
She's living. Okay. And your social. Do you smoke?
No.
Do you use drugs?
No.
Do you drink alcohol?
A few times.
What do you
about
drink?
1 to 2 times a week.
And
Beer.
how much?
3 to 5.
Okay. And are you married?
Yes, with 1 daughter.
And what do you do for work?
Construction.
And do you use caffeine?
No.
No caffeine. Do you exercise?
3 to 5 times a week. Strength training.
And can you tell me about your diet?
Fruit, veggies, candy, protein.
Okay. All right. So, do you have any nausea or vomiting with this headache?
No.
All right. Any decreased appetite?
Yep.
Okay. Any fever or fatigue?
Fatigue.
No fever.
No.
Weight loss?
No.
Okay. Any eye drainage?
Yeah, my right side.
Okay. And do you have any eye pain?
No.
Any eye redness?
Yep, my right side.
And any double vision or blurred vision?
No.
Any nasal congestion?
No.
Both sides are clear. Your nose.
Oh, my right side.
Okay. Any bloody nose or
No.
no bloody nose? Smelling's intact. You feel like you're smelling things okay?
Yeah.
Okay. And then, do you have a recent ear infection?
No.
Ear drainage or ear pain?
No.
Okay. What about throat? Do you have a sore throat?
No.
Any redness or drainage in your throat?
No.
Do you feel like mentally, are you having problems thinking or remembering what you want to say?
Sometimes.
Do you feel like your memory is intact?
Yep.
Do you feel like you're slower at work?
Yep.
Do you have you had any fainting?
No.
Seizures?
No.
Dizziness?
No.
Spinning or vertigo?
No.
Neck pain?
No.
Tingling or numbness?
Nope.
Any extremity weakness or just weakness in general?
Mm-mm.
Paralysis?
Nope.
Pain, tingling, numbness, weak, paralysis. Let's see. Okay, so can you tell me your name and
Scott.
your date of birth?
12/4/86.
And where are you?
The doctor office.
And what day is it?
Monday.
And why are you here?
Because I have a headache.
So mental status is intact times 4. We're going to assess the cranial nerves. We're going to do cranial nerves 2 through 12. The first is optic, so I'm going to assess your vision. Can you read the bottom line? Yes, by covering your eye.
Or nicer to be.
And then the next bottom line.
Straight up a tree.
And then we're going to assess both visual fields.
Then try at least.
Perfect. So the next thing we're going to do is, now that we could use a ophthalmoscope and check the fundus for this cranial nerve 2, we'll move on to cranial nerve 2 and 3 and check pupil size and pupil constriction. So they're equal, round, and intact. They are reactive to light. Lid elevation, he is able to lift his eyes. And oculomotor will also be assessed here. So we'll do the 6 cardinal gazes, which will assess cranial nerve 3, cranial nerve 3, 4, and 6. So here we go. And we're looking for shaking, involuntary eye movement, and nystagmus. And I am not seeing any at the moment. Good, and then accommodation. And we'd look for ptosis here, and which is drooping of the eye, which there is not any. So then we're going to move on to cranial nerve 5, which is the trigeminal here, and clench your teeth, open your mouth, move your jaw side to side. It's intact. That's the motor portion. Now we will do the sensory portion. Please close your eyes. Sharp or dull?
Soft.
Sharp or dull?
Dull.
Sharp or dull?
Dull.
Sharp or dull?
Dull.
Sharp.
Sharp. Dull.
Good. We would also here assess the corneal reflex, but we're not going to do that for the purpose of this video. And then we're going to move on to, we've already assessed cranial nerve 6 with the cardinal gaze, and cranial nerve 7, which is facial, motor. Smile, please. Frown, and raise your eyebrows, and puff out your cheeks, and close your eyes. Don't let me close. Open them. Okay, good. Good. For sensory, we would make sure tasting. We would do tasting. Have you had any problems tasting your food? Okay. Now we're going to move on to that was 7. Now we're going to do 8, which is acoustic. I'm going to have you plug your ear right here and do the whispered test.
4. 5.
Okay, we'll do this ear one more time.
3.
Okay, good. So now we're going to move on to cranial nerve 9 and 10, and we're going to, that's assessing his voice. Is it hoarse, which it's not. And then we're going to assess for is he got any congestion or anything like that, and he doesn't. So we're going to look at his uvula. Is it at the midline? And it is. There's no deviation there. We would also could test the gag here for 9 and 10. And then for 11, we are going to do spinal accessory testing here. Shoulder shrug, good. Sternocleidomastoid, resisting to me here, good. And we're checking here and here, good. And then we're going to do the Last one, 12, which is assessing the tongue. Can you stick out the tongue? Good. It's no atrophy or fasciculations. And then we're going to, I'm going to test his strength here. Can you touch me on the sides there with your tongue? Good. Okay. So now that we've done that, we're going to do some rapid movement. So can you do this, this, and this as fast as you can? Okay. Slow down. Let's try it again. So it's going to this, up, down, this. Good. Then we're going to do this. And this is testing the cerebellar function. Good. And then the point of finger here, touch your nose and touch my finger. Over here. Good. Okay. So if any of those were off, we would be concerned about cerebellar lesion. And then we are going to test gait, which when he walked in here, I noticed there was no abnormal, so I'm going to have you walk on your toes that way and then walk on your heels on the way back. So he can walk on his toes, good. Walk on your heels on the way back, and then heel-toe walk. This also tests for cerebellar function, and that's good. So then we're going to have you sit down, and then I'm going to have you identify with your eyes closed. Close your eyes. Open your hands. What's in there?
Key.
Good. And then keep your eyes closed. Tell me what number I'm writing.
3.
Good. So those are all intact. That is for sensory cortex. We can note that those were normal and intact. So then we're going to test for, I'm going to have you lie flat and test your nuchal rigidity, Radinsky's sign. So lie flat, going to lift up his neck, good. And he didn't have any flexion there. And then the Kernig's sign, which is going to be, I'm going to take his knee here, flex. Do you have any pain? Good. We'll do it on this side. Good. So then you can stand up. So we've assessed his gait. I would listen to heart and lungs for the sake of being thorough. Deep breath. And then we did our, if you weren't able to walk on your heels, I don't know if I said this, you could have a cortispinal lesion. My differentials are he has a cluster headache or migraine or sinus infection headache. And yeah, that concludes the exam.